Welcome, dear friends of wise old age. Today, I want to discuss a topic critical to men's health, particularly for those over 50 years of age, a medical examination that, although it may cause some discomfort or reluctance, is essential for the prevention of serious diseases, the digital rectal examination. This procedure plays an essential role in health assessments, especially for detecting conditions affecting the prostate or rectal area. Before proceeding, it's important to emphasize that this content is aimed at older individuals, a stage in life when prioritizing health is crucial. We will address this topic with the respect and rigor it deserves, helping you understand its importance and approach it with confidence. The goal of this talk is to provide a clear and respectful explanation of what the digital rectal examination entails, what it feels like, and its role in early detection. Understanding the details of this test may help reduce the anxiety or discomfort some men experience. By the end of this discussion, I hope you will feel more at ease and secure about the process. What is the digital rectal examination? Known in medicine as the digital rectal exam, this procedure involves the doctor inserting a gloved and lubricated finger into the patient's rectum. This allows the specialist to feel the prostate gland, located just in front of the rectum, as well as the rectal wall, to check for any abnormalities. The primary purpose of this test is to assess prostate health, detecting changes in size, shape, or texture that may suggest conditions such as benign prostatic hyperplasia, infections, or, in more serious cases, cancer. Additionally, the exam can help identify other conditions in the area, such as fissures, hemorrhoids, or masses that may require further investigation. What does it feel like? The sensations experienced during a digital rectal examination can vary. From a physical perspective, it is common to feel pressure when the doctor inserts their finger into the rectum. This pressure may create a sensation of needing to evacuate due to the proximity of the anal sphincter and surrounding nerves. However, this feeling is temporary and typically lasts only a few seconds. Some men might feel mild discomfort or unease, especially if they are tense or unable to relax during the procedure. For this reason, it is advisable to stay as relaxed as possible, take deep breaths, and trust the medical professional. Tension can heighten the perception of discomfort. Proper lubrication and a careful approach by the doctor also help minimize any unpleasant sensations. Emotional aspects of the exam. For some, the digital rectal examination can provoke anxiety, embarrassment, or discomfort. Social taboos or preconceived notions about masculinity often contribute to resistance against this type of test. It's essential to recognize that this procedure is a standard medical practice conducted solely to safeguard health. Medical professionals are generally aware of the nervousness their patients might feel and often explain each step of the process with respect and care, ensuring the experience is as comfortable as possible. Why is the digital rectal examination important? The digital rectal examination has immense value in the early detection of abnormalities. It can significantly influence the outcome of certain diseases. For instance, in the case of prostate cancer, early detection in men over 50 years of age can greatly improve treatment options and survival rates. During the exam, the doctor checks for signs such as nodules, unusual enlargement of the gland, or irregular texture. While these findings may initially seem concerning, they are not always indicative of cancer. Many benign conditions, such as benign prostatic hyperplasia, can affect the prostate. It is very common in older men to experience benign prostatic hyperplasia, BPH, which can cause uncomfortable urinary symptoms but does not represent a serious threat to life. The digital rectal examination also allows for the detection of other issues in the rectal area. The presence of anal fissures or hemorrhoids, for example, can be identified through this method. Early detection of such problems is beneficial, as it facilitates treatment before the situation becomes more complicated. Preparing for the digital rectal exam. Some tips can help make the exam as comfortable as possible. Before the consultation, it is advisable to talk openly with your doctor, expressing any questions or concerns. This not only helps reduce anxiety but also allows the patient to better understand the procedure. During the exam, relaxing as much as possible, breathing deeply, and maintaining a comfortable posture are key factors that can minimize any discomfort. Some patients find it helpful to focus on their breathing or another sensory stimulus, which can reduce the perception of pressure in the rectal area. The doctor, for their part, should always use sterile gloves and a lubricant to facilitate insertion, ensuring the process is as smooth and comfortable as possible. The importance of the digital rectal examination. A digital rectal examination is a brief, quick, and highly useful procedure. It should not be considered painful or traumatic, but rather seen as an essential tool for maintaining health. Unfortunately, the stigma surrounding this examination leads many men to avoid it, depriving themselves of early detection opportunities. For this procedure to be accepted and normalized within the medical context, it is crucial to view it as a standard aspect of adult self-care. Taking care of yourself in later life means being willing to undergo necessary tests to maintain health. Although some tests may be uncomfortable, prevention is always the best approach. A simple examination like this can make a significant difference in the quality of life for an older man. If you are over 50 years old and have never had a digital rectal examination, I encourage you to schedule a consultation with your doctor. Health is a gift that we must protect, and small efforts like this can have a big impact in the long run. Closing thoughts. Dear friends, I hope this talk has helped clarify your doubts and, more importantly, demystify a procedure that is fundamentally an act of self-care. I invite you to reflect on your health and make informed decisions. At Wise Old Age, we believe that knowledge is power. When it comes to our health, understanding what to expect and why can provide peace of mind and the confidence to face any exam. Thank you for joining me today. I invite you to subscribe to our channel, Wise Old Age, Sexuality and Health, to continue learning about how to care for our bodies and minds as we age. Remember, health has no age, and it is never too late to start taking care of yourself. Until next time, take care.